Hey y'all, my name is Jillian Stoll, and today we'll be talking about canine infectious respiratory disease complex and its novel counterpart, atypical canine infectious respiratory disease. I first became interested in this topic when I was working at a vet clinic and wanted to know more about respiratory diseases in dogs, and also over the summer when it was first diagnosed as atypical canine infectious respiratory disease, and wanted to make sure that I was keeping myself, my pets, and the pets I was caring for as safe as possible. Let's get started. Canine infectious respiratory disease complex, or CIRDC, is a syndrome that encompasses many different viral and bacterial infections that can cause a variety of upper respiratory systems in dogs of varying severity. The symptoms for this disease and the contagions involved can vary, but the most common are a mild fever, nasal discharge, a cough, and it has the potential in severe cases, when left untreated, to develop into a secondary infection such as pneumonia. The diseases included in this complex are canine adenovirus 2, B. bronchoseptica, Mycoplasma cynos, Streptococcus zooepidemicus, canine distemper virus, canine herpes virus 1, canine influenza virus, canine parainfluenza virus, and canine respiratory coronavirus. This complex is often referred to as kennel cough, as the origination of this disease and its diagnosis was from high-volume shelters in which these agents would spread rapidly through aerosol means of transmission. Because of its contagiousness and affinity to cause secondary respiratory infections, which have the potential to cause great harm, a vaccine was developed encompassing some of these contagions, but specifically targeting Bordetella bronchoseptica, which is commonly referred to as the Bordetella vaccination. This vaccine was first developed in the late 1970s and has continued to undergo development since to improve and change in accordance with evolving bacteria and viruses. One of the contagions that is not encompassed in the Bordetella vaccination, however, is the canine influenza virus. A bivalent vaccine was recently developed for the prevention of both strains, H3N2 and H3N8, of the influenza virus. One of the most recent additions to the contagions that are associated with CIRDC is canine respiratory virus, which is a new strain of canine coronavirus that specifically targets the respiratory system, as opposed to causing mild enteritis. In addition to the development of vaccines preventing the contraction of CIRDC, there has also been recent development in the technologies used to diagnose CIRDC and its agents. As recently as 2023, the diagnosis of severe acute respiratory syndrome coronavirus 2 has been added to a one-step multiplex detection test used to detect and identify 12 pathogens associated with CIRDC. This ability to detect and identify the precise agent or agents causing the symptoms has proven useful not only for research into each of the agents and their contagiousness respectively, but also into their individual treatment. Dogs with mild cases of CIRDC don't require treatment, and clinical signs should resolve within a week. However, some cases, especially when they involve young, old, or dogs with pre-existing conditions that make them more susceptible to respiratory problems, may require treatment. Cough suppressants are often used for temporary relief for the patient if necessary for recovery, but also for the peace of mind of owners. More severe cases may require the use of a stronger narcotic antitussive for the relief of the patient. More severe cases, or cases suspecting of leading to a secondary infection, such as pneumonia, may require the use of antibiotics and antimicrobials, which can help treat a wide array of the contagions included in CIRDC. However, in the past year, there have been the emergence of a new upper respiratory disease that has been resistant to treatment from both antibiotics and antimicrobials. This novel disease has been named atypical canine infectious respiratory disease, or ACIRD, and was first diagnosed in Oregon in late summer 2023. Since its discovery, there have been over 200 reported cases in Oregon, resulting in an unknown number of fatalities, and has reached the states of California, Colorado, Florida, Georgia, Idaho, Illinois, Indiana, Maine, Maryland, Massachusetts, New Hampshire, Nevada, North Dakota, Pennsylvania, Rhode Island, Texas, Vermont, and Washington. The clinical signs of ACIRD fall into the three following syndromes. The first, chronic mild moderate tracheobronchitis with prolonged duration, usually 6 to 8 weeks or more, with signs including coughing, sneezing, and serous or mucoid oculonasal discharge. The second is chronic pneumonia that is minimally responsive to antimicrobials with signs that may include dyspnea. The third is acute pneumonia that rapidly becomes severe and may lead to death within 24 to 36 hours. At this time, there is no known single causative pathogen, but a viral nature is suspected among many. Additionally, there is no current evidence for zoonotic potential. This has been of great concern to pet owners, particularly because of the lack of knowledge that is known about the disease. The current means for diagnosis is the presence of symptoms, but testing negative for all other known contagions included in CIRDC. The current number of cases is unknown, but has been known to cause death in severe cases. Because of the lack of knowledge and its resistance to antibiotics and antimicrobials, the current means of treatment is purely symptomatic and on an as-needed basis. However, it is still not known whether or not this is a novel disease or purely a particularly aggressive and treatment-resistant strain of something already been identified. There are currently multiple universities and companies doing research on the known cases in order to identify the contagion and develop a treatment plan in addition to a vaccine if possible. Until such discoveries have been made, it is the advice of medical professionals to avoid areas of higher risk, which include places with large volumes of animals or places that are more prone to outbreak, including kennels, dog parks, daycare facilities, and also to not share things between pets like toys or bowls. It's also important in light of the recent COVID-19 pandemic that owners make sure that their pets are up to date on vaccinations, especially if they fell behind or lapsed during the stay-at-home period. Thank you.